Good morning. Thank you for joining our webinar today on the benefits of coaching. What does the research say and how do we evaluate coaching? We're so glad you are all with us this morning. We are going to begin, and please let us know if our volume is appropriate. If you need us to talk a little bit louder, let us know. But first of all, thank you. Good morning. We're so glad you're here. It's a brief break from the rain out here in California. It's a sunny, blue sky kind of day, and I hope all of you across the country are either inside and nice and snugly warm from what we hear is some snowy cold weather, or you are enjoying the sun if there is sun where you are. Welcome. We've got people, like I said, from all over the country. We're going to share some information about what we're doing out here in California on coaching and some of the learning that we are engaging in on what makes coaching move from good, solid coaching to really great coaching. We are going to host a series of webinars this spring. This is our first one. Our next coaching webinar that I hope you can join us for will be on March 7th, and the topic will be coaching clients and adolescents. We have several more webinars that will occur after that once a month until June, and you can find more information about our webinar series on the Northern California Training Academy website. You just do a quick Google search. I think the website is on our last slide, and we will you'll be able to find our webinars. We're sending out emails. One notice is if you have received the email about this webinar from a colleague, you'll need to join our email list to get the emails firsthand. So please remember to check the box that you'd like to receive updates on coaching offerings from us, and we'll make sure to get you on our list. We are going to record the webinar today, and that recording will be available on our website after we complete the webinar. A little bit about our presenters today. I have the distinct joy and honor to be co-presenting with a new colleague of mine, who is April Allen.
Hi, everyone. I am so glad to be here and to be able to share the work that I've been doing with the Northern California Training Academy. My name is, as Nancy said, April Allen, and my background is in child welfare and human services research and policy. So after those experiences, I started an independent consulting firm and have been working as a consultant and instructor with the Northern California Training Academy over the last several months. So happy to be here.
And we're very happy she has joined our team. She is she's very smart, and we're very, very lucky to have her helping to guide some of the evaluation efforts that we're engaging in.
You can't see me, but she's making me blush.
I am happy to recognize many names on the attendee list. I've met many of you through my work here in California and a couple of different states across the country, but also because of the National Conference on Coaching and Human Services. I am an academic coordinator here at the Northern California Training Academy. And I guess one other thing to add is that we have been doing coaching for about 10 years here at the Academy, and I've been part of those coaching efforts since the beginning. So a little bit of background about the Northern California Training Academy. We serve 28 counties in Northern California, all public child welfare agencies, and we offer a variety of workforce development efforts for all of the counties that we serve. Most notably, safety organized practice, continuous quality improvement, trauma-informed services, and coaching. And we embed coaching in as many programs as we can. We, like I said, have been coaching for about 10 years, since 2009. We are currently offering coaching in 11 of our 28 counties. And then we also coach supervisors and other leaders in some of our supervisor-specific classes and offer some leadership coaching for program managers and directors. We do a combination of leadership and skills-based coaching. These are a few of our coaching specific offerings. We have just piloted and are teaching the coaching based case management classes for both clients and transitional aged youth. Our second webinar will be on this topic. We are also moving to hosting the National Conference on Coaching and Human Services every other year. So we had one in 2017, 2018, and our next coaching conference will be in April 2020. In addition, we have published our coaching toolkit for child welfare practitioners. That is available for purchase from the UC Davis bookstore, or you can download a copy if you visit our website and fill out a form, and we will email you a PDF version of that coaching toolkit. So first, we wanted to get everybody a little bit more familiar with the technology of the webinar. We are going to ask our first polling question. We are going to have a couple of these throughout the hours so that we can engage with you at least a little bit. We'd like to tell you, for you to tell us a little bit about who you are. So a poll should be now on your screen, and if you could let us know which role best represents you, that would be great. Excellent. So a few last second, get your answers in. Okay, now I do not believe you can see the poll in progress, so I'm going to end the polling and share the results with you. Okay, so you can see the majority of our participants are other. I would please, why don't you chat in what other represents? In the chat window, you can just write in what that other represents. We'd love to know. And then it looks that's pretty even across child welfare leadership supervisors, some analysts and social workers, university partners. Excellent. We've got some probation. Wonderful. Oh, this is so wonderful. Excellent, excellent. Thank you so much. It's so great to see all of you here. Tribal TANF, wraparound, peer support, Family Resource Center. Excellent, excellent. Okay, we are going to do our next polling question is going to be on where are you from? So what region of the US are you in right now? Excellent. All right, looks like California is in the house. Not a surprise. We've got, okay, I'm gonna end the polling. California, there you go. You can see 73% of folks are from California. Northwest, West, Southwest, Midwest, South, Northeast, Pacific. All right. Perhaps somebody from Hawaii is with us. Excellent. Anchorage, Alaska. Wonderful. Thank you so much. Hope you're getting a lot of snow today. Great. Thank you.
Where does Maryland fit?
Maryland fits, I believe, in the Northeast. There is also some technology that you have available, which is a question and answer window. You can find it on your toolbar for Zoom. We'll practice doing some questions in a specific time, but you are welcome to ask us a question whenever you'd like. So you can type that in your window box, and we will be able to answer questions as they come up, either on that Q&A panel or in the chat screen. So our hope for today is to define some of the key core elements of coaching, to highlight some of our skills-based coaching model and the work that we've been doing with that skills-based model, to discuss what some of the specific gains from coaching are, and to review some of our study findings from an evaluation of coaching we have just conducted in partnership with KC Family Programs, for who we are very, very grateful have worked with us to evaluate some of our efforts. So speaking of the question and A section that you have access to, you can go ahead and type in a question or an expectation of what you hope to get out of this webinar. So if there is something specifically that you'd like for us to answer or discuss in this webinar, please go ahead and find that Q&A section of your of the Zoom screen and let us know.
And there are a couple questions that have come in around whether the slides will be available. We will share the recording, which will have the slides embedded, so you'll be able to see the slides and hear the audio, but we're not going to send out the slides as a PDF.
Great, excellent. And I'm glad that you're finding the Zoom window. We've got a question if we'll discuss how to evaluate effectiveness of coaching. Absolutely. We'll hope to provide some more tools for toolboxes. So great, excellent. Difference between supervision and coaching. Some of this we might be able to touch on if we have time at the end of the webinar. Well, we'll have a Q&A specific section. And Alexis will try to answer that question for you there. Great, excellent. So briefly, we're going to talk just a little bit and make sure we all get on the same page about what coaching is. We find that that's one of probably the most important things that we can do when we start talking about coaching, because it is one of those topics that everybody has had some experience with, that everybody has a definition of what coaching is. And sometimes it turns out that they're different from what other people, how they might define coaching. We here in Northern California define coaching as a human development process that involves structured, focused interaction and the use of appropriate strategies, tools, and techniques to promote desirable and sustainable change. Importantly, both for the benefit of the learner and also other stakeholders. We have potentially for other stakeholders, and we change that and say absolutely for other stakeholders. We are in the business of coaching to help improve outcomes for children and families. That is why we are engaged in workforce development. That is what we would like to see as a result of coaching, is improved practice, which then obviously leads to the potential for improved outcomes for children and families. Now, is it easy to make a direct link between coaching and improvements and outcomes? No, not necessarily, but that is absolutely the end game. That is what drives us in our work. There are, when we talk about the definition of coaching, coaching has come to the field of human services from a variety of different places. We all inherently understand that there are benefits from coaching, but lots of jurisdictions are grappling with what kind of model might fit best in, because coaching is coming from coming into human services from different streams, which is also one of the reasons why evaluation and research of coaching is so desperately needed and timely right now. We here at UC Davis mostly use a skills-based model, which hails from the field of education. We have pulled this model to really focus on building skill, and it utilizes a system of observation and demonstration with reflection and feedback as part of that. That is the bulk of where we like to see the focus of our coaching. We also do engage in some executive leadership style coaching when we're coaching leaders and administrators. There is also, we know that agencies across the country have looked at some of the life coaching / executive coaching models, which follow the, sort of become a leader in your own life philosophy. We bring this up to understand, we bring this up because it's important to understand that there are differences between these coaching models. And the research or evaluation of one of these models may be very different from the others. And we really are in a place where we need to understand the nuances between them and what are the best interventions for the field of human services. While I think we can all agree that coaching is inherently a useful, is useful for the person who is receiving the coaching. There's been a lot of research just on general coaching, and coaching works. It does benefit the person who is receiving coaching. But what we don't know is how does it benefit that person so that they are improved social workers and supervisors, and does it improve how our professionals engage with their colleagues and partners and community partners, families and children, so that it leads to that improved outcome. And that is what is so important to understand, is not just that coaching works, but how is it working, who is it benefiting, and how can we make it the most effective and efficient coaching possible. Because I'm assuming that many of you are like us here, where resources are not to be taken for granted and are somewhat limited. We work with what we have, and we want to get the sort of the best bang for what we can offer. So this is not, we don't want to engage in coaching just because we think that it will work. We really want to know what's the best kind, how do we make it more effective, and what can we do to improve those outcomes. Okay, we're going to do another poll. This time we're going to find out how many of you use coaching in your profession or in your agency, I'm sorry. If you've been using it for some time, not yet, you sure would like to, or if you've just started. Okay, last second to vote. Okay, as you can see, more than half of you have been coaching for some time. Well, more than half of you, because some of you have just started. 30% of you, 29% of you have just started, and a good solid 18% have not yet, but would like to. Okay, thank you. You can see on your screen, this is our UC Davis Child Welfare Skills-Based Model. If you download a copy of our toolkit, you can read more about what the skills-based model looks like, and you can see the cycle of observation and demonstration through facilitated reflection and feedback. Some of the core functions of coaching, the why of coaching, why people implement coaching, are points to some of the key functions, which are things like supporting staff by providing feedback, promoting transfer of learning from training in active real-world settings, modeling behaviors, sustaining interventions past initial implementation. Later on in the presentation, we're going to talk about whether or not coaching actually delivers on these functions and which ones does it do so most effectively. You'll see on your screen how we think that coaching works. Coaching, one of the reasons why it fits so well with human services is because of the similarities between coaching and solutions-focused practice, which we have all heard much about. A model that you see on your screen comes from David Rock in his book, Quiet Leadership. And he talks about how coaching is really in the land of seeking solutions and asking open-ended questions. And that's where we know that benefits happen, that success happens, is when we ask good questions and we focus on solutions. And that is what we're attempting to do with coaching. There are some studies, external experts have served as coaches, but staff being coached have found that sometimes external coaches lack understanding of local context. We also know that some coaches are internal, which means they're embedded in the organization. They're in-house coaches. And some have invested some substantial training opportunities to develop those in-house coaches. These homegrown coaches, they've been found to be more involved in planning phases and lead implementation. But some studies on the converse have found that internal coaches sometimes lack that specific subject matter expertise of external coaches. So we'll again discuss some of this later on in the presentation, but you can see that some of the nuances of the coaching evaluation is really trying to get at which way do we go? Internal coaches, external coaches, or maybe it's a mixture of both, but we have to be very clear about when we use which type. We'd like to find out how many of you use internal or external coaches, so that we can have a sense anecdotally of what's happening across the field. So if you could fill out this poll question, that'd be great. Okay, a few last minute votes coming in. Internal or external coaches. And it looks like we've got mostly internal coaches, with 67% are using internal coaches and 33% are using external. Excellent. Thank you so much. Oops, I think I need to share the results. There we go. There's the results that you can see. So at this point, I'm going to pass the baton to April, who is going to lead us in a conversation on evidence for coaching gains.
All right. So as Nancy said, some of the work that has been going on is just to define coaching. What is it? Why do we use it? But we also need to kind of take a scientific approach and step back and say, well, what evidence do we have that coaching works? And as you heard from Nancy, a little bit of a spoiler alert, we have found quite a bit of different levels of evidence that supports that. So we did a literature review that it really focused in on what was going on in human services with coaching, and are going to share some of those results with you before jumping into talking about the study. So just to start out with, the great thing about coaching is that it's easily understood, right? We've all kind of had a coach in our day-to-day life at some point, a teacher, someone who teaches us and helps us learn. So while coaching is easily understood, that's great, but we need more evidence, right? We need to understand how coaching has been deployed in human services and how specific areas, whether it's probation or child welfare, might be affected or supported by coaching. One of the things that we looked at when we were categorizing the different types of evidence was that coaches at some point, a lot of the studies focused on attitudes and experiences, which is great as a start, but we really wanted to move towards coaching that makes a difference and understand how and if and how the evidence supported that type of model. In synthesizing the literature, we identified some studies that would fit within this coaching benefits pyramid model. So it was developed by Leadham, and we have the foundational factors of coaching, processes, where coaching is happening, who the coaches are. And those must be in place to get the second tier benefits around clarity and focus, these changes in attitudes and motivation. And that in turn supports changes in skills and behaviors. And those finally, we believe, will lead to these overall results for children, families, and the communities that we serve. So we're going to talk about some of the pieces of evidence that we found that fit into this model. The first kind of light bulb moment that we had was that words and perceptions matter, right? Many studies found that there were positive effects of coaching. If you say, hey, someone, I'm going to give you the opportunity to have a coach and to support your own professional development or skill acquisition, often that is positively received. But the focus and the delivery and how that is framed really matters. So studies found that coaching that was supportive consultation and was presented that way to staff was much better received than anything that was fidelity monitoring or compliance focused. The other piece that we needed to think about is that delivery of coaching has to evolve over time, because the way that specific staff needs might change as staff acquire more skills and move forward. Good coaching has nuance. In general, because we all kind of understand what coaching is, we can say, oh, you know, I go into a meeting, but we need to have an understanding of the strategies as well as what we are doing. So here, the important part was that coaching is not unconditional positivity. At the same time, it's not just that compliance focus. So when individuals were asked about their experiences receiving coaching in some of the studies that we reviewed, people were unhappy just to be told in an entirely strengths-based way, you're doing a really great job. They actually sought constructive feedback so that they could acquire and learn more skills or to develop those skills further. One piece that was promising, even in studies that had more of a compliance-focused coaching or fidelity monitoring type of coaching, was that even staff who were initially resistant to that type of coaching reported positive assessments after the coaching process had started. A little bit of to know you is to love you. Moving up the tiers of the pyramid, as we're thinking beyond individual changes in attitudes or perceptions about the coaching, we found that training alone is not sufficient for skill acquisition and transfer of learning. Several of the studies that we noted found that training alone did not have the changes in either attitudes and or skills. There have been studies in education that have focused on the relatively limited benefits of theory and demonstration and practice-focused professional development. And what they found in that setting was that coaching overwhelmingly had positive effects. And so right now we're trying to move and develop that work within the human services field. A lot of the studies that we looked at talked about coaching within the context of implementation of evidence-based practices or policies or models. And especially given the current policy focus in that direction, understanding how and when coaching was used and how it can be helpful within the implementation process was really interesting for us. So the literature review that we did identified coaching supporting not just the far end of sustaining an intervention, but initial installation. And it goes back to what Nancy was sharing around internal coaches kind of being more involved. So there are benefits and drawbacks to each type of coach, and this was a clear benefit of some of the internal coaches because they knew the context, they could help modify and ensure that the intervention was going to fit the local context. The other piece that is, I think, most important is that there are very few studies that look at the effect of coaching on child and family outcomes, which of course is the very top tier of the benefits, coaching benefits pyramid. But one of the studies that did a randomized control trial found that coaches had the most positive effect on implementation of an intervention. In this case, it was around child safety and recurrence of maltreatment. For those cases that were receiving the model, but they were atypical in some way. They were less like the typical child or family served by this model. So this adaptation function was really important and really interesting, and something that we saw in our own work as well. So moving beyond initial installation, we saw a lot of literature talking about coaching as the fidelity monitoring function, or to make sure that after an intervention you took the trouble of installing it, that something good would continue to happen, that you would continue to experience and work on and implement that intervention. One of the studies that we reviewed had a great way of describing it. So guardians of fidelity. Coaches become the people who in some ways can make sure that the intervention or practice that you are trying to ensure staff use, it is supporting that and continually reminding them about the best way and how to do it, as well as adapting it to that context. And yes, for anyone who's wondering, that is the Guardians of the Galaxy font. We just couldn't help ourselves. So that pieces of the literature really informed the work that we were doing when we talked about safety organized practice coaching in Northern California. We understood that there were gaps within the literature, mostly in how to understand coaching all the way up to the top of that pyramid, not just how people perceived it or how it changed their attitudes, but was it making a difference for children and families? So the study that we did really focused on an exploration, some initial first steps that we could do to start contributing to the literature. So before we jump in there, we're going to do another poll question. And what we'd like to know is how many of you have evaluated your coaching efforts? We know that often in human services settings, there is a lot going on and it takes almost every inch of brain space just to implement coaching and then support it. And so to step back and have to evaluate it and to have the time, expertise, and resources to do so was something we're very mindful of the challenges of. So there was a question about, just while we're waiting for the poll to be answered, a question about whether the agency that received the funding and showed improved safety outcomes, about whether the coaching program was sustained. I do not know that. It was a study published in Pediatrics in 2012. I believe it was in the mid-Eastern Atlantic, but I'd have to check. But given that it was an evidence-based model and might have been supported by some of the MICB funding, I'm happy to check into that. So we'll have our contact information at the end. I'm happy to share that resource afterwards. All right, so we have the results. So we see that the biggest group, the plurality of individuals, 45%, have not yet evaluated coaching efforts. A quarter of the group has, which is great. And as we get into the Q&A, we'd love to hear from you about what you learned from that and how we can start sharing this knowledge with the field. So I'm going to share a little bit about the study that we did. And I think the most important part to say is that this was exploratory, early in nature, a relatively small study, but we really wanted to focus our research questions on understanding what do we want to see if coaching has an effect. Starting with the scientific method, we had a hypothesis and we were testing it. And these were the three areas. The first was, does coaching affect empowerment and motivation, right? So that second tier of our coaching benefits model. And does it change the quality of child welfare practice, including safety organized practice? That gets into the skills and behavior change that you can get once you often have that change in attitude. Then we also wanted to know, was there any effect of coaching on supervisory skills and abilities, as well as the quality of supervision received by workers? We actually looked at it from both angles. Did supervisors feel that they had better supervisory skills, and did workers feel like they received better supervision? And finally, the last question we looked at was, does coaching affect implementation of safety organized practice at the county level? So as Nancy had shared, within the 11 counties that are currently receiving coaching and the 20-some that have received coaching over the past 5 to 10 years, we believe, or the thought was that coaching would help these counties adapt the intervention and make sure that there was that fidelity monitoring and support, but we needed evidence to find out if this was the case. So a brief overview of our methods. The study used a hybrid effectiveness implementation design. And so just at a high level, these types of designs help people, especially in fast-moving fields, human services, among others, to more quickly move from implementing an intervention to understanding how it was implemented and what effects it had. We wanted to understand how coaching had been used across these counties and any positive or negative effects that it had. So we truly were able to collect information on both of those fronts using these particular methods. We used mixed methods, so quantitative data from existing evaluation surveys that have been collected over multiple years. I know that many individuals who are doing professional development and coaching will have satisfaction surveys and might be sitting on a lot of data. So it was helpful to see that quite a few of you, just going back to our poll, about 20% of the people who responded had have some data that you could use. One of the things that we will share here is the importance of using what you have. These were not perfect surveys that we could design and administer broadly, but it was information that we had that we could start working on and continually develop and start understanding where things were going and start if we were moving in the right direction. The surveys were administered to learners within the counties, as well as a detailed coaching activity log that was filled out every time a coaching session was done. So there were about 150 learner surveys, mostly concentrated in one particular county. And then for the coaching session, there was just under 1,000 individual coaching tracking logs over the last 2 years. There was also a survey of about 35 child welfare leaders and workers across 14 different counties that shared some feedback about the implementation process of safety organized practice and coaching, as well as how coaching was perceived within that. So as you can see, there was a lot of existing data that we could leverage to answer some of the research questions that we had. We did collect some qualitative interview data as well, because there were questions and pieces of information that were not included in the secondary data analysis. So we did interviews and focus groups across 4 different counties. There were 8 individual phone interviews and then 2 focus groups for a total of 21 respondents. So we're going to briefly share just a few high-level findings. We will be sharing much more, but in the interest of time, we just wanted to share some information going up the coaching benefits pyramid. So at a high level, we wanted to know, how did learners rate the coaching experience? This is that foundational level of, what was it like to be coached? Was the environment great? Did you not enjoy the particular coach or their methods? So here what we found was that overall there was an average rating on a scale of 1 to 10 of 7.97. So across all the different roles, people thought that coaching was pretty helpful. And then you can see across the different levels, social workers actually were the ones who found coaching most helpful, which, and when you think about skill-based coaching, that might be a level where the coaches were able to help that individuals in that particular role develop some of their skills. In the same way, when we look by their child welfare experience and their tenure within that organization, individuals who had been in their roles for less than 10 years were more likely to rate coaching as helpful, as very helpful. And then finally, the rating by length of coaching relationship. So this is, how long have you actually received coaching? We found that individuals who had received coaching for 2 or more years had a very high average rating overall, the highest of all the different groups. But that we found a slightly more nuanced view when we asked specific questions about, for example, the coaching environment and goal setting process. And the individuals who had received coaching for 2 or more years actually had while still overall high, the kind of more tempered view of how and when coaching was helpful. So it's something that we're happy to share more as we dig into the data and continue to move forward. Then we wanted to move on to the improved motivation and skill part. So that's the second and third tier of our coaching benefits pyramid. And you'll see the numbers of respondents are at the left, and then on the right side of the screen, you'll see the percentage of respondents. Important to note that individuals who responded to this could indicate more than one, and often did, more than one response. So when we look at what the individuals responded here, the learners 2/3 of them indicated that they had improved motivation after their most recent coaching session. Half of them had new knowledge. And then when we move into what are you going to do with that motivation and knowledge, it was promising to see that almost 50% of them had a plan for skill development. And over 40% had new or refined goals or an improved sense of empowerment. So this, the plan for skill development is great, but we also wanted to kind of validate that a little bit more with as much as we could with the existing data. So in the quality and effectiveness survey, individuals in leadership roles and others were asked, has coaching had a positive effect on social worker practice? And almost 3/4 of them, 71%, either agreed or strongly agreed that coaching had that positive effect. This was a small sample size, as I said, so about 36 individuals representing 14 counties, but the survey was administered to individuals who could speak to the experiences of their county. So we weren't looking to hear from everyone because that was what the learner survey was doing, but rather to step back and say, from the outside, do you think that there has been this positive impact on social worker practice? So this is just an example of some of the findings of coaching gains, but as you see, we've moved up the levels of the coaching benefits pyramid. And what we could see around safety organized practice coaching in Northern California is that there have been both positive assessments of the coaching experience, reports of a change in attitude, as well as individual self-reports of changed skill and practice, as well as external validation of that at a high level. We do have continuing efforts where we're going to use case review tools and be able to validate specifically how social worker practice might have changed. But at a high level, these results have been very promising. So we're going to pause for a poll question and just see, for those of you who said that you had evaluated your coaching interventions over the last little while, we'd love to know at a high level anything that you found. Have you noticed positive change as a result of the coaching that staff have received? All right, I'll give you a couple more seconds. And if you have had a chance to answer the poll question, be sure to drop into the Q&A and add any questions that you would like for us to answer towards the end as well. Okay, so almost half of the individuals who responded, about 48%, said that you've noticed a positive change as a result of the coaching staff have received. About 1/3 said maybe, hard to tell, and the rest said we don't use coaching. So, of the people who received coaching, it was either maybe or yes. And again, no, coaching in general is supposed to be supportive and to be helpful, but we do want to get to evidence and understand how it's being helpful and how we can retool. It kind of brings me back to that positive overall rating of coaching, where the people who received SOP coaching from the Northern California Training Academy said, yes, this was helpful. But then when we asked them specific questions about different elements of the coaching experience, they had more nuanced feedback that we could use to improve and to understand what might be driving any improvements that we've seen. All right, so well, just a couple more things that we want to touch on. When we designed the study, it was not just to understand the benefits from coaching, but also things that could be done to improve coaching. I mentioned that hybrid implementation design where we're also going to understand implementation as well as effectiveness. And so we had a goal right from the start to say, how can we improve coaching? And a lot of the qualitative interviews focused on that, as well as particular stories that individuals had about how coaching was helpful in their social work practice and in their supervision and implementation of safety organized practice. So in terms of logistics, there were suggestions to reconsider the mandate to participate in coaching. And I think anytime something is mandated, staff are coming from a place where they might experience the same intervention in a different way simply because it has been mandated. And the staff who experienced mandated coaching had great suggestions for feedback, but did note the way that making it mandated changed the way they viewed it. And that kind of goes back to the compliance monitoring focus that we had identified previously in the literature. Provide ample opportunities in terms of timely responses for learner inquiries. A good coach is responsive, and a good coach has to be able to fit the needs of the learner population that's being coached. And in child welfare, sometimes the questions don't come up in a regularly scheduled monthly or every other month session. And so it was important to the individuals who were being coached to have ways to get timely feedback and ongoing support. We also in the study, although we didn't get into it here, assessed the coaching dose. So if we are in the medical field, we'd want to know what was the dosage of our intervention, and then what was the actual effect that we saw. And so we asked individuals how often they had received coaching, how long they had received coaching for, to try to get at that duration and frequency. And one thing that was important to the respondents when they suggested it was to consider the multiple ways that individuals might be receiving coaching, and to figure out the ways to have it delivered in a way that was responsive to learner needs. There was a lot of requests for group coaching, for example, all at one level, although there was coaching that was occurring with a supervisor and workers, or kind of up that line. Supervisors actually requested group supervision coaching because they would like to talk to their peers at that same level. In terms of the coaching staff and coaching relationship, there was a little bit of mixed feedback around whether people who had recently left the agency should be the coaches, or if it was helpful to have more of a separation and an outside view. One of the main benefits that people said was that they enjoyed having someone with a different perspective. And for an agency and staff who might have just left that agency to come back and coach, you might not have gotten as much of that different perspective. In terms of the coaching relationship, managers in particular wanted to know ways that they could get feedback from the coaches about staff needs, growth, and development without undermining that coaching relationship. And that's a tricky thing to do, because part of the safe space of learning that can happen in coaching is that it's not your boss who's looking over your shoulder. And then finally, in terms of the coaching delivery and strategies, it was important to the learners to have set goals and to have a plan for each coaching session, whether that was identified in advance or developed at the beginning of the coaching session. In terms of having that outside perspective, it was important to some people that you could balance the directive coaching with more thoughtful questions and observation. We had some results that actually asked about the strategies that coaches used and the topics that were covered. And it was interesting to me that listening was the predominant coaching strategy across many of the coaching sessions. And then finally, in terms of delivery, it was important to consider the implementation stage and learner experience when setting those coaching goals. Individuals who had been receiving coaching for 2 or more years might have needed less of a frequency, or different types of support for more nuanced questions, rather than delivering it the same way that maybe newer staff might have needed it. So those suggestions for improvement were really helpful and will inform the continual evolution of coaching and SOP coaching for the Northern California Training Academy. I will briefly mention that there were, of course, some study limitations, as there are with every study. So the first part is that this was an exploratory study. It had, a relatively small qualitative sample size, and we were limited by using these secondary surveys. But it was great because, especially for the coaching activity tracker, we had up to the moment information about every single coaching session that was provided, as well as what was discussed at a high level and the strategies that were used, which is a huge step forward for the field. There was an uneven response rate across counties, so these findings may not be fully generalizable across Northern California or to other settings outside of the region. And then finally, the self-reported nature of many of the tools. It's kind of not a necessary evil, but you have to work with what you've got. And so moving towards understanding what people self-report and then to more objective measures such as a case review tool is a really important next step for us. So if you haven't already, please feel free to add some questions to the Q&A. We're going to start answering those in just a minute, and would love your comments as well as your questions. Before we move on to that, we just want to gratefully acknowledge again the funding and support from Casey Family Programs. The research and opinions and things that we've shared are our own, but again, we are grateful for their partnership. We are thankful to the interview and focus group respondents who shared their time and insights with us in their very busy days, as well as the partners from counties who facilitated the research process and who have participated in coaching over the last decade. And finally, the many Northern California Training Academy staff who contributed to the research and report that will be forthcoming. Right. So we are going to move on to some questions. Our email addresses are on the slide if you want to follow up with us after, but we can jump into some questions.
Great. We have a question from Tara about where we can, or when everyone can access or read the results of our study, and that will be forthcoming.
Yep.
We're working on it.
Yes, we will have some results that we can share in different domains, but feel free, if you have a particular question, feel free to email us because we do want to hear from the field on this.
And with that, if you all have been engaging in any evaluation efforts of your own coaching, we'd love to connect about what you might be finding or what some of your study designs are. So please email us. You got both of our email addresses. We'd love to talk and discuss and find out what others are doing across the field.
So there's a question about how we can evaluate the effectiveness of coaching. And as I think about the many of you on the phone and your colleagues who might have had coaching and evaluated it or want to evaluate it, I think as much as possible, if we can start understanding at least the domains that are important to measure and how we're measuring things, right? To be very clear, if it's self-reported, if it's opinion-based, if it's moving from Likert scales of, strongly agree, neither, to things like case reviews or that study that I mentioned that actually looked at child and family outcomes. So just consider as you're designing your studies, not only what information you're collecting, how quickly you can return that information to the field, which is a priority for this study, but also how it fits into the broader literature. Because I think as we collectively work to build this evidence base for coaching in child welfare and human services generally, we're going to be able to deliver better coaching.
We have a question here, April. What qualitative measures have you identified for coaching evaluation?
Mm-hmm. So we were really guided by the research questions that I identified earlier on. So I wanted to know, how did people experience coaching to get at that foundational level of the coaching benefits pyramid? So what was it like? How was it delivered? What was the environment? Was it group coaching? And some of these things we could then triangulate across data sources and see how the secondary data analysis of the surveys, for example, was different than the people that we talked to. And then we wanted to hear about changes in attitudes and skills. And so in some ways that was helpful to hear at a little bit of a deeper level or have a conversation about. But the most valuable part for us with the qualitative interviews was actually the stories. We wanted to know, how has coaching helped you? And how could it be improved? But could you tell us a story about why? And we had some fantastic responses of people sharing, working with families where they just had not been able to break through, and having a coach with them either in the moment or following up after, share, do something or build that relationship, not just with the workers, but also with the family, and to bring that additional level of expertise. The individuals that we spoke with really noted that having someone with an extensive amount of child welfare experience, and not just someone who had trained on the safety organized practice model, really made a difference, because they could look up to and engage with that expert, as well as engage with their longer tenure in child welfare.
We do not, Esther asked this question, we do not lack for qualitative measures. we have a lot of qualitative measures for coaching, enough so that we drove April a little bit mad when she first started diving into this project. What's more difficult is the quantitative data measures for coaching evaluation, beyond sort of the learner surveys. So it's what numbers can we really look at in terms of how effective is coaching, and I think that's one of the things that we need to start looking at is what can we count. So, for example, will will social workers or human service workers use more family team meetings as a result of coaching? And can we somehow quantify that? Can we quantify how how effectively they engage with families and clients? And looking at ways to quantify, I think some of the work that we do would be beneficial, at least to the evaluators.
Well, and the other piece is that if we continue to measure things in different ways and to talk about them in different ways, we're not going to be able to compare or understand what elements of coaching worked in this context versus another. And so when I think about public health and education, other fields that have used coaching, they have validated tools that people use and have agreed on and have shown that are reliable and will get to that quantitative level of information. So that's a wide open area that I'm sure would be great to explore in the future.
We also have another question on how we can make effective surveys to get live data to coaches to improve their practice, so a continuous quality improvement cycle. But the follow-up is, can there be survey fatigue if we survey every single time? Yes, there can be survey fatigue, which we do to people. We fatigue them with our surveys. So that does happen, and it is a challenge because we want to know how it's going, and we don't want to keep asking over and over when it's basically the same kind of coaching from the same coach. We have backed off from asking every month or every session to maybe every couple of months. And we have still heard that there's a lot of surveys.
I think one thing that was helpful for us in this study in particular was that the coaches really had the burden of data collection, and they were being paid for their time, so it was in their best interest to do this. And so to have that complete record of what happened in the coaching session, and to know that it covered every single time someone was coached, was a really rich data source that often is not available. So if you think about that, think about how you can leverage your coaches either retrospectively or ideally prospectively, right? What are you going into a coaching session with a plan? What were the goals of that coaching session? And then on the other side, did you achieve those goals? Right? And you have to use that judiciously, but when you can get that level of information, I think it's valuable.
We also received a question on how the Northern Academy will retool our coaching based on some of the results of our coaching study. And I think an answer to that is that we need to learn more. I think we have more work to do. I think we've gotten some good feedback that our coaching is working and that we're on the right track. And we need to study a little bit more to find out where we can really truly be more effective. But we are absolutely using the results to tweak and make some adjustments as we go.
I think the other area that the continual, if we're doing a CQI process to coaching, it's also a CQI process to some of the measures that are being used, and to know the questions that came up as we analyze the existing survey data. To maybe we want to retool slightly some of the existing evaluation surveys, or how we ask questions of the coaches as they're reporting on what was conducted in the coaching session. So that level as well.
Great. We have two last questions I'd like to answer real quick before we hit our 11 o'clock mark, which is there's a coaching toolkit, a question about where to access the coaching toolkit. If you visit our website, if you, again, Google search for the Northern California Training Academy, UC Davis, Continuing and Professional Education, you will find a link on our website to either the bookstore to order a copy of the toolkit, or to order a copy of the PDF that we can send out to you. And then somebody also asked, Patricia asked, how many sessions of coaching in 2019 we'll offer. Again, visit our website and we will email you a survey about the webinar, and we'll include our website on that. That will have a link to our coaching sessions that we are offering, so you can learn more about what we offer and what classes you can participate in. And I think that wraps us up. So thank you all so much for joining us. For those of you who we were not able to answer your questions, please email us and come to our webinars that we will host within the next several months, and we'll be sure to answer your questions there. So we hope you have a great day, and thanks so much for joining us. We appreciate it.
Thank you all.
Have a good one. Bye.